Hello everyone, my name is Archana Pond. I am a lecturer from Pravara Medical Trust, College of Pharmacy, Shevgaon. My subject is Pharmaceutical Chemistry 2nd. So our next topic is hypoglycemic agent or anti-diabetic agents. In this content we have to see definition of hypoglycemic agent, classification which include insulin, chloropropamide, tolbutamide, glibenclamide, fenformin and metformin. First is the definition of hypoglycemic agent or anti-diabetic agents. See, the drug which lower the blood sugar level are used in treatment of diabetes mellitus are known as hypoglycemic agent. We have seen many times the meaning of hypoglycemic. Hypo means decrease and glycemic means glucose, which decreases the agents which decreases the glucose level, they are known as anti-diabetic agents or hypoglycemic agents. Means these are the agents which are used in treatment of diabetes mellitus. They are known as hypoglycemic agents. Next, in classifications, it is divided into three types: hormones, which include insulin and its derivatives. Next is the oral hypoglycemic agents, which is divided into two types: sulfonylurea derivative, example is chloropropamide, tolbutamide, glibenclamide. And next is biguanide derivatives, which include fenformin and metformin. And the third one is plant sources, which include gaurgam. So this is the classification of anti-diabetic agent. Next, first we have to see insulin. We have learned many times what is insulin. Insulin, it is the hormone, or insulin, it is the protein hormone which is secreted by beta cells of islets of Langerhans of pancreas. Commercially the source of insulin in pancreas of ox and pig. So the properties of this insulin are: it is a white powder, it is slightly soluble in water, it dissolves in dilute solution of mineral acids, it is also soluble in alkali hydroxide, in which it is hydrolyzed, it is inactivated by proteolytic enzymes, which plays many important function in the body, like helping breakdown of food into energy. Also they can improve our digestion or decreases the inflammation in our body. It is sensitive to heat and light. As it is sensitive to heat and light, so it should be stored. You can see here the images. It is sensitive to heat and light, so it should be stored in temperature between 2 and 8 degrees Celsius and should not allow to freeze. And the insulin injection is stored in multi-dose container. So we have seen these three images. So it is sensitive to heat and light, it should be stored in between temperature 2 and 8 degrees Celsius, and it should not allow to freeze, and it is stored in multi-dose container. So this is about stability and storage of insulin. Next, where we use this insulin, we all know that it is used to control diabetes mellitus. It is also used to regulate carbohydrate metabolism. It is used in treatment of hyperkalemia, means there is a high level of potassium in the blood, that is hyperkalemia. It is used in treatment of hyperkalemia. It is used to treat severe ketosis or diabetic coma. These are the uses of insulin. The official preparations are insulin injection, BP, IP, neutral insulin injection, BP, globin zinc insulin injection, BP, IP, isophane insulin injection, BP, IP, biphasic insulin injection, BP, protamine zinc insulin injection, BP and IP. We all know what is BP and what is IP. Insulin zinc suspension in crystalline form and insulin zinc suspension. These are the official preparations of insulin. These are the stable preparations. So this is all about insulin. Next is chloropropamide. Chloropropamide, we have seen it is a sulfonylurea derivative. It is mentioned in the classification, it is a sulfonylurea derivative. The properties of this chloropropamide are: it occurs as a white crystalline powder, it is odorless and tasteless, it is practically insoluble in water but soluble in an alcohol, It is soluble in a solution of alkali hydroxide. And the stability and the storage of this chloropropamide is it should be stored in a well closed container. Here is the structure of chloropropamide. The chemical name is 1p chlorobenzene sulfonyl 3 propyl urea. This is the chemical name of chloropropamide, 1 para chlorobenzene sulfonyl 3 propyl urea. And the brand names are dibenzene, diabatol, diabetin. These are the brand names. And the preparations are chloropropamide tablet. Here is the image of chloropropamide tablet. You can see here in the slide chloropropamide tablet PPIP. And the uses are, it is a non-insulin diabetes mellitus, means it is used in treatment of non-insulin dependent diabetes mellitus. We have seen in first year there are two types of diabetes, insulin dependent and non-insulin dependent. So this chloropropamide is used in treatment of non-insulin dependent diabetes mellitus and in mild to moderate diabetes insipidus. So this is all about chloropropamide. Next is tolbutamide. It is a sulfonyl urea derivative. The properties of tolbutamide are it occurs as a white crystalline powder. It is odorless and it is practically insoluble in water but soluble in an alcohol. Here is the image of chloropropamide powder. It is a white crystalline powder. It is odorless and it is practically insoluble in water and soluble in an alcohol. Here is the image of preparation of tolbutamide tablet. You can see here in the upper side tolbutamide tablet BP and IP. The brand names are Rastinone and Tolutap. These two are the brand names which are available in the market. So this is all about tolbutamide. Next is the fenformin. Fenformin, it is a bigunite derivative. The structure is given over here. The chemical name is 1,2-phenyl ethyl bigunite. It is a, as I told you, bigunite derivative we have seen in classification. Here is the images of fenformin powder. It is a white crystalline powder. It has a bitter taste. It is soluble in water and alcohol. And the stability of this fenformin is it should be stored in well closed tight container protected from light. The uses are, it is used in treatment of diabetes mellitus. It is used to reduce blood sugar level in cortisone induced hyperglycemia and also used to reduce blood cholesterol in maturity onset diabetes. You can see here the brand names are DBI and Chloroform. Here is the packaging and storage of this fenformin, and the uses are given over here which I just told you. Then next is glibenclamide. Glibenclamide, it is a white crystalline powder. It is odorless and it is very slightly soluble in water. Storage of this glibenclamide is it should be stored in a well closed container. The uses are, it is used to treat diabetes mellitus. It is also used as a substitute for other hypoglycemic agents. The dosage form, here is the image. The glibenclamide tablet are available in the market. The brand names are Davunil and Euglucon. Here is the brand name in the at the downside you can see brand names are Davunil and Euglucon. Then the next is metformin. And the metformin, it is a white hygroscopic crystalline powder with bitter taste. It is practically insoluble in ether or chloroform. These are the official preparations. Metformin tablets 500 mg and 250 mg. The uses are, it is used to treat type 2 diabetes mellitus. The brand names are Carbophage, Glucophage, Cetapin and Glycomed. So this is all about metformin. We have seen we have seen the various antidiabetic agent, that is insulin, then chloropropamide, tolbutamide, fenformin and metformin, and also glibenclamide. So this is all about anti-diabetic agent or hypoglycemic agent we have covered in this topic. Thank you so much.